Well, hello, students. This is the lecture on juvenile arthritis and related rheumatology conditions for pediatric conditions. So there is about 300,000 children in the United States with doctor-diagnosed juvenile arthritis, with some form of juvenile arthritis. This is more than Duchenne's muscular dystrophy, cystic fibrosis, and sickle cell combined. Juvenile arthritis is an umbrella term that describes over 100 different forms and types of autoimmune and inflammatory conditions diagnosed in children under 16 years old. So even though I'm 37, I still have juvenile arthritis. It will always be juvenile arthritis or juvenile lupus or juvenile dermatomyositis, no matter how old you get. If you're diagnosed at 17 or 18, then it's considered the adult form of the disease. And they are different diseases. So the basic definition for arthritis, if you use your medical terminology knowledge, is arth stands for joint and itis stands for inflammation. So the word arthritis itself just means joint inflammation. But when you put the rheumatoid in front of it for juvenile rheumatoid arthritis or juvenile idiopathic arthritis, which is what it's called now, or systemic lupus erythematosus or dermatomyositis, it's actually an autoimmune disease besides just an inflammatory disease. So it affects a lot more than just inflammation of the joints, especially in children where, like we said, it's not just the kid form of the adult rheumatoid arthritis or the adult lupus. It's a different disease process. And only about 10% of juvenile rheumatoid arthritis or juvenile idiopathic arthritis mirrors adult rheumatoid arthritis. So it always was called juvenile rheumatoid arthritis, but then about 10 years ago, I'd say, it's really been solidified in the last 5 years. Europe changed their nomenclature first. We switched in the United States, and like I said, Europe and other countries have switched before us to juvenile idiopathic arthritis for a couple of different reasons, but one of the main reasons is to really separate it from adult arthritis, since it is a different disease process and different prognosis. And so idiopathic means that there's no known cause. So some of the kids you have to really explain, they hear the idiopathic and they at a younger age think that it's something to do with idiot and it means that they're an idiot and that's why they have it. So that's really important in the education, even of young kids. 3-year-olds sometimes in the playground will be, you're an idiot, you're stupid. And they know it's a bad word even if they don't know what it means. And then of course in elementary school, they get to know what it means. So really having them understand that idiopathic, what I always say to little kids is just means the researchers and the scientists are kind of idiots right now where they don't know what it means. Of course, I don't say that about the doctors, and I don't say that often, but sometimes with the older teenagers, we'll joke about that. So juvenile idiopathic arthritis is the most common form of those 100 different forms or types of autoimmune inflammatory conditions that are underneath that umbrella of juvenile arthritis. And there's 3 main subtypes of JIA. So there are 3 subtypes of juvenile idiopathic arthritis. There is systemic. It used to be called systemic. It's still called systemic arthritis. It used to be called pauciarticular when it was JRA, and now that it's JIA, it's called oligoarthritis. And it used to be called polyarticular, and when it was JRA, now that it's JIA, it's called polyarthritis. The reason I give you both names is a lot of people still use the old names, like pauci or poly. So articular is joint. Pauci and the OLIGO both mean few. So that means at the time of diagnosis, you have 4 or less joints that are affected. And then poly means many, in Latin. So that means at the time of diagnosis, you have 5 or more joints that are affected. That doesn't mean you can get diagnosed with POSI and then you can end up having more joints as the disease progresses that are affected. But that is just time of diagnosis. And then there's other things too that you guys don't have to know. If you're diagnosed with POSI, you're more at risk for these complications. You're diagnosed with poly, you're more at risk for this. There's things with if you have a positive ANA blood type or Rh factor, whether it's positive or negative, maybe you're more at risk for iritis, eye issues or not, but that you don't have to know. One thing to know is when we say many joints, people can have every joint in their body affected. And I think sometimes people don't realize how many joints there are. Like every little joint in your toe and the bones in your feet, your jaws. There's actually where your ribs meet your sternum. There's synovial lining there. And we'll talk about it, that's actually what gets inflamed is the synovial lining and fluid. So people can actually get pressure and pain in their chest. If sometimes people say it feels like a heart attack or like an elephant sitting on their chest, specific term called costochondritis. That means you have inflammation there. You have joints where your ribs meet kind of on the side of your body, and just joints everywhere that I think people sometimes don't think about. We just think of our big like hips, knees, elbows, shoulders, but there's a lot of joints in your body. And then not the other subtypes of juvenile arthritis, but juvenile idiopathic arthritis specifically does affect girls more than boys, 3 to 1. So 3 times more girls than boys. So again, this is just true for JIA, not for all the types of JA. So like I said, there's 100 different forms of juvenile arthritis. I'm not going to go through all of them. You don't have to know all of them, but just a few other types that are very common in kids, again, is systemic lupus erythematosus or juvenile lupus. Juvenile dermatomyositis, or people shorten it as JDM. Scleroderma, which in Latin means hard skin. Ankylosing spondylitis. And again, if you break it down, the dermatomyositis, derm is skin, dermato is muscle, myo is muscle, citis is inflammation. You can understand it's not only inflammation of the joints, but of the skin and the muscles. And scleroderma in Latin means hard skin, and it's where the skin actually gets inflamed, and so inflamed it kind of hardens up, and it makes the joints contract. So a hand would be like that. So again, these are all in that inflammatory autoimmune family of inflammation of joints or skin or muscle that all go in that rheumatology umbrella. And a little trivia, this will not be on your exam, but a little trivia is lupus was actually named, 1700s or 1800s. You'd have to check me on that. But the cool thing about the name is one of the characteristics of lupus is you can get these really predominant rashes that we now call a butterfly rash. So you'll see a lot of like organizations and things with lupus, and there'll be like butterfly symbols and butterfly wings, and other people with lupus will like get a butterfly tattoo or like have butterfly jewelry or pictures. And so one of the classic rashes is this rash across the bridge of the nose and the cheeks that go like this, that we now say the bridge of the nose is like the body of the butterfly and this is like the wings. But back in 17 or 1800s, I forget, when this disease was originally being like discovered and named as a disease, they thought it looked like a wolf bite, like across the face, like that, like the teeth of the wolf. So lupus means wolf in Latin. And as you're learning your medical terminology, basically, medical language is basically Latin. So if you know Latin, you understand all these things are named in Latin. So that's a little trivia for you. Not anything you have to write down or remember, just some fun trivia. Okay, So again, people think that only adults get arthritis, and what we try to teach is kids get arthritis too. So she is the face of arthritis. So 300,000 children in the US have doctor diagnosed arthritis, and that doesn't account the adults. That only counts 18 and under. So like I said, I still have juvenile rheumatoid arthritis or juvenile idiopathic arthritis at 37, but when they're counting the children in the US that have arthritis, they're just counting 0 to 17 or 18. I forget the statistics. And again, more than Duchenne's muscular dystrophy, sickle cell, and cystic fibrosis combined. It's the number one cause of acquired disability in children. So meaning like not an accident where you were paralyzed or something like that, but an acquired disability. And the sixth most common childhood disease. So it's a lot more prevalent than people realize. 50 children die from it each year. And I actually, in the United States, I and a lot of other people in the rheumatology field that are much greater medical experts than me on it, researchers and physicians and very notable people in the field of pediatric rheumatology believe that number is actually higher. And what happens is, maybe they die of a blood clot or a side effect from a medication or a heart issue, but really it's from the arthritis because maybe they have JDM or lupus and the inflammation doesn't or systemic arthritis where the inflammation doesn't just affect their joints, but it affects their muscles and their organs too. So people with lupus and systemic arthritis can have heart issues and kidney issues, can be on dialysis, can have major cardiac issues. So maybe the death certificate says they died from, kidney failure, they died from a heart attack or arrhythmia, so it doesn't get coded as dying from juvenile arthritis, but really it is. And that's kind of the problem in adult arthritis too. The number is actually much higher than the statistics show because of how it gets coded on the death certificates as cause of death. So this isn't to scare parents, it's a very controllable disease typically. And most kids do really well, but it is for us in the medical world to really understand the severity of the disease and not to blow off they just have arthritis, I'm not going to see them today or put them high on my priority list. To really understand, it's not just your grandma's arthritis. So your grandma and grandpa's arthritis is osteoarthritis, which is wear and tear on the joints. It's not an inflammatory process. It's not an autoimmune process. I'm not diminishing the pain that exists and the issues with mobility and function, but it truly does affect the joints. Where juvenile arthritis, the different forms, lupus, JIA, JDM, really are autoimmune and inflammatory diseases. So it's much more than just wear and tear on the joints. It's a whole systemic, whole body disease. So there is no cure, which you're learning. That is one of the definitions of a chronic illness. It's an autoimmune disease that affects the joints, soft and connective tissues, and organs. The recommended treatment is mild chemotherapy. So it's true, I've been on chemotherapy since I was 6 years old. I was in the phase 3 FDA trial for a drug called methotrexate, which is a chemotherapy drug that commonly gets used in the treatment of juvenile arthritis as well as some other chemotherapy drugs. So now we also have a class of drugs called biologics, which also get used but still get used in conjunction with the chemotherapy. So the theory behind it is, or how I explain it to young kids, is in cancer, the bad cells or the cancer cells are rapidly dividing, right? And are growing too big. And that's what cancer is. They're rapidly dividing and they're growing too big. And in arthritis, the bad cells eat the good cells. So what actually happens in arthritis is in your joint, you have synovial lining and synovial fluid in the joint. And the arthritis actually eats away at that and eats away at the joint. And that's the bad cells eating away at the good cells in your joint. And so what chemotherapy does is it kills the bad cells. And that's why we use it both in oncology and rheumatology. And so the difference is in oncology, you get high dose chemotherapy and you might have it for a week or 3 weeks and then get a break for a month or whatever, and then get another high dose, and you may do this for a year or 2 years, on and off and get breaks in between. What happens in the rheumatology field is you get a lower dose, but you get it like every week, constantly. Like I said, I've had it since I was, well, for 30, what would that be? 31 years now, since I was 6 and I'm 37 now. So, but all those same side effects that you have from chemotherapy in oncology patients, you can have in rheumatology patients. So kids with arthritis are more likely to develop cancer, have a shorter life expectancy, age faster, have an increased risk of heart disease, stroke, anemia, lung problems, infection, and depression. And as you're learning, depression and anxiety, there's a high prevalence in the U.S. among adolescents and young adults, and you add a chronic illness and that incident just increases. So at the time of this posting, it says 13 states do not have a pediatric rheumatologist. And now we're down to 8 or 9 states currently as of this year. But that's a big issue in peds rheumatology, and we'll talk about that, is the lack of access to appropriate and trained providers. So she is the face of arthritis. She needs a cure. Obviously, this is a poster to get some fundraising, but it has a lot of great facts, so that's why I like to use it. All right. So some of the medical information. So the process of the diagnosis for juvenile arthritis is one of the things that causes a lot of frustration and fear, and one of the reasons that patients and families need a lot of emotional support during the process of diagnosis. So unlike some of the other chronic illnesses that you've learned about, like cystic fibrosis, you can do a sweat test, sickle cell, just a simple blood test, things like that. The process of diagnosis for juvenile arthritis, is what we call a diagnosis of exclusion, meaning they have to rule everything else out that could possibly be causing the symptoms. And then you have to have a certain set of symptoms and a certain number that persists for 3 months or more with no other cause. So by definition, it's at least going to take 3 months of a lot of tests to diagnosis. But in reality, it often takes years of ruling it out, especially in kids who can't always reliably tell their symptoms. A lot of times there's ambiguity about it, what it could be. Providers, especially general practice providers, often don't realize that kids get arthritis too, and that kids as young as infants can get arthritis. I started showing symptoms at 8 months old myself. And so there's a lot of, my mom went through, and I've heard this story 100 times over from other families. You're a crazy mom, you're overprotective, you're a first-time mom that doesn't know what they're doing. Your child's just trying to manipulate you. Well, we know at 8 months and 11 months, children don't have the cognitive ability to manipulate. But if it was like a 6-year-old that they thought this was behavior, that they were limping or complaining of pain and not wanting to go to bed or go to school, they can use that behavioral card. So I've never heard a simple diagnosis story once, and it's usually filled with a lot of frustration and emotions, and sometimes creates a lot of distrust with the medical community. So that's a time when patients and families need a lot of support, and they often don't understand. The medical community, sometimes we don't do a great job of communicating that we think it's arthritis, like we have an idea what it is, but we still have to do all these MRIs, x-rays, and joint tabs and other tests to rule out these things. It's not that we're fishing and we don't know. This is just the process of diagnosis. And some providers are afraid to say, I think it's arthritis, but I have to do everything else first, so we're not as transparent. And then that makes patients and parents feel like we don't know what we're doing and we're just fishing, which causes a lot of, understandably, like distrust. And now I don't want you to care for my child because I don't think you knew what the heck you were doing. So, symptoms of, I apologize, I am really sniffly today. Symptoms of arthritis, big ones are inflammation in the joints. You can tell inflammation by swelling, actually redness, actual heat. Joints will be hot to the touch. Lack of range of motion, meaning lack of ability to move the joint because it's so swollen. Pain and fatigue. So fatigue is one of the hardest things to treat with arthritis, and it's also one of the most frustrating things to cope with on a daily basis for kids and adults with arthritis. It's one of the hardest things to teach coping skills because you can teach kids, and adults for that matter, to try to pace themselves and not overdo it. But everybody is different. There's not a formula of do this much of activity in a day and then rest this much and you'll be okay. And even for the same person, it's not like me after 37 years, I have my perfect formula figured out. Like it varies day to day and week to week and year to year depending on my disease process. So it's really hard to, you don't just want to lay in bed all day and not have a life, but you don't want to do too much and overdo it. And it's like, where is that balance? And there's no perfect formula. And there's no medicine like pain or inflammation that you can give to try to help it. And pain does play into fatigue, and fatigue plays into pain definitely. So sometimes if you're addressing pain, that helps fatigue a little bit, but not all of it. You could have no pain and just have straight fatigue. So fatigue still, I mean, for me personally, and you talk to other like teenagers and young adults and older adults like me, it's still one of the most frustrating things to cope with and deal with. You can, teach a lot of both pharmaceutical and non-pharmaceutical modalities for pain. You can have medicine and non-pharmaceutical things to try to help with inflammation and lack of range of motion. And a lot of times kids and teenagers, one of the hard parts for them with coping is I can no longer play tennis at the level I could, or I can't, horseback ride anymore because my hips don't do this, or I can't downhill ski anymore because my ankles. And we'll literally have kids that are diagnosed in their teenage years. Like last week, they were doing like, high level varsity basketball, and the next week they can't walk because of the arthritis. So kids with arthritis get diagnosed at any age, like I said, from infancy all the way up to adolescence and young adult, and then, that's adult arthritis then. But it literally can be as jarring as a 16-year-old who is like going for college scholarships in a competitive sport and then the next day can't walk. It can be that life altering. So personally, there's always this debate among those of us with juvenile arthritis that I personally think it was easier to be diagnosed in infancy because I've never known life without it. So I've never been like, well, I used to be able to do this and now I miss it. Where I feel like it would be so much harder to be diagnosed in the adolescent, like the late school age adolescent years, when you've been able to do all this stuff and now it gets like, you feel like it gets taken away from you. And just adolescence itself, I think, is such a turmoil, tumultuous time for psychosocial issues. Like, I think just being an adolescent warrants like being in counseling or therapy or having a psychosocial professional help you, and then you add in being diagnosed with a chronic illness. But there are adolescents then that argue that, at least they got to do those things and knew what it was like. But so often for kids initially, the hard part, especially teenagers, is the things that they're losing that they can no longer do, or kids that were diagnosed in infancy when they reach school age and adolescent, like, I can't go downhill skiing with my friends or play competitive sports or whatever. And that varies from person to person. There's some kids with mild arthritis that still are able to do a lot of activities, but long term, you kind of get over that. The hard part is still the fatigue and fatigue isn't just, I didn't sleep well last night and I woke up and I'm tired. It's this like total body, you can sleep as much as you want, You're not just tired, but you literally feel like you got run over by a Mack truck. Um, so there's this woman, her name is Christine, and we're gonna look at her. She has juvenile lupus, and she wrote this thing called the spoon theory. That I'm gonna try to find now. I had it pulled up when she was in college to try to explain to one of her friends. There it is, about fatigue. And so she has lupus herself, but it really applies to any rheumatology diagnosis. And but you don't look sick. She has a whole website now of merchandise and other stories, but this was the original thing, the spoon theory, that kicked it off. Just a 2-page. I will post it. I would really appreciate, I'll post in the module below this lecture. I'd really appreciate if you'd read through it. Kind of like the Welcome to Holland. I think it's very impactful for all kind of rheumatology diseases. And so it's really been taken on by the whole rheumatology community. People get spoon jewelry and collect spoon things, and people get spoon tattoos. People call themselves spoonies. There's like spoonie groups. One of my friends, one of the bracelets I wear to work a lot, that I wear when I'm lecturing to you guys, has 3 spoons on it. It says never give up, and it's like my friend gave it to me, so always have a couple extra spoons with me if I need them. So I'd really encourage you. It's a great way to kind of explain the fatigue factor and or something some people call cripple time or crip time, where everything takes longer. You really have to think about everything you're doing and kind of debate if it's worth it or not. So I will post that. I encourage you to read it. Okay. The other thing I was going to show you was